be giving some commentary on that. It was a fabulous article. She's been passionate about palliative care, about integrative medicine sorts of issues. She has been a leader in trying to put together some exercise classes in her own backyard. There's been an interest in karate actually in her patients, and so they've put together some group karate classes that she'll speak to as well, and we've shared some ideas around that. And so it's a pleasure. And one of the reasons that I had reached out to Jori is because she continues to connect on social media through Facebook with some of her patients who've been homebound, and has been sharing some strategies in that regard. And I wanted to bring some of those to us as well. So we're hoping to hit a few topics today. And she comes to us from her own house with her children as well, corralled somewhere apparently. So yes, with that said, Jori, let's please fill in the blanks, Jori, if there's anything I missed in terms of your passions.
No, thank you so much. Thank you, Indu, for inviting me to do this. Thank you to PMD Alliance, and thank you to all of you. Hopefully you can all hear me, and hopefully you cannot hear 2-year-old possibly making noise when she should be napping, and a 5-year-old who is desperately being entertained by his father downstairs. If they interrupt, I'm sorry. But I think this is a tremendous opportunity for all of us to come together. And as Indu was saying, I was sort of active on Facebook and posted something which, like so many other things that I've done, has been inspired by my patients or a particular patient. And I actually got an email, I think it was last Monday. All of these days have sort of blurred together now. But a patient of mine who has supported some projects, and he does all the right things. This is someone with Parkinson's who is exercising, he's doing aerobics, he's weight training, he's doing Pilates, he's doing yoga, he's mindful, he's got all of this stuff in line. And age seems like just a number, especially for him. And he sent me this quick email, just a one-liner that says, do I really need to take this seriously? Like how big of a deal is this for me? And it really inspired me thinking about all of my folks, thinking about, aging parents and grandparents who say, yeah, okay, fine. I hear some of these recommendations, but do I really need to stay home? Do I really need to do this stuff? And the answer was just this immediate, oh my God, yes. But how do I help keep you sane and staying active and preserving all of the wins that he has had and that so many of my patients have had with all the things that they're doing? And so I just kind of scribbled out onto my iPhone with kids running around, you need to stay home, but here's what you can do. You need to keep drinking water. Here's what you can do. You got to stay exercising, and here's what you can do. And so have thankfully taken some of that and written it up a little bit more coherently than that first version. But I thought I could kind of talk through some of those things.
Yeah, absolutely.
So, I mean, I know that there have been other Zoom webinars and things like that, but just to reiterate the point that really, 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 everyone needs to be staying home so that we can do the work of taking care of everyone, so that the hospitals are not inundated with any more people than they need. Staying home to protect yourselves and to protect your loved ones is really the only way that we kind of slow this crazy thing that's going on right now. And so now that you're home, what do? Right? So things like this are fantastic. If you're a first-time Zoom user, congratulations, you've made it. The fact that you've got it, if you're hearing and seeing at the same time, you're like 75th percentile already. If you have an Apple device and you can FaceTime, maybe you've used it before, maybe you haven't, now is an awesome time to try that out. If you don't, if you're using another kind of smartphone, there are all kinds of different services. You can, face chat, video chat with kids, grandkids, neighbors, friends, colleagues, on any number of different platforms. You can use Skype, you can use WhatsApp, you can use Facebook to do all of these things. So if you haven't tried them yet, give them a try, rate them, decide which ones you like, But I think this gives us a really nice opportunity to take advantage of some of the technology that's out there, even if it hasn't been at the top of our list before. It's there, so we might as well use it. If there's someone that you've been meaning to call, but you just haven't had the time to catch up with that friend, and it's been a while and it's kind of like awkward to call them after this long, they're sitting at home too. Now's the time. You have a perfect excuse. Just thought I'd check in. And I think that they would probably welcome it too. I sort of have my list of people. I'm like, all right, well, now's a good time to call. I don't remember how old their kids are, but that's okay, because same, it's mutual. So I think that's a really nice thing. And one of the things that has sort of sprung up within groups of friends, and I've heard about this from other people, is, you know, if you're someone that feels like you just need to take a time out at the end of the day, you can schedule a virtual happy hour with friends, right? And whether that's, you know, with alcohol, without alcohol, whatever it is, if that's raising a cookie in the air and toasting it, right? I think a way to come together as a group of friends has been really powerful. I know for me, I don't know if anyone else has been doing that, but it's been a really nice way to sort of check in on everyone and just have a break to say, you know what, this is really hard. But I see that, you know, we're all together, and that makes it a little bit better. The other thing that I told this patient who said, yeah, but I've got my appointment with my trainer. And I went, yeah, you know what? Call the trainer. All appointments, really anything. If that appendix is not bursting, you should be staying home, right? The level of what should I be going into the hospital or to any other facility for? I want you to think appendix bursting. That's sort of the level, because otherwise stay home and hospital systems are really finding ways to be able to connect with people by phone, by telemedicine, sort of like this. We want to keep you out of the hospital and away from exposure, but it also applies to therapy appointments. And I know there are a lot of therapists that are working on platforms like this to be able to conduct therapy. If you're not already seeing a physical therapist or speech or OT, there are all kinds of ways to do that and get some of those benefits online. There are a couple services, and I can share some of the ones that I've found and some exercises. We can post those, but I think, let me see, I'm going to move around some windows on my screen. I can share these with you guys. I know if you
We can post them at the end too.
Perfect.
So, and then they'll have a link, and we've been doing that with every talk. So it's kind of cool. And then Andrea also sometimes she'll Google stuff. I mean, she's magical. I don't know, or somebody's
Awesome.
over there magically. Every time I say something that requires a link, they like post it somewhere here in this chat, like in 2 seconds later. So it's pretty awesome.
Fantastic.
Yeah.
Yeah, so I can share those. There's stuff out there that I had no idea was even out there. So apparently there have been resources before we even really needed them.
Mm-hmm.
And now that we really need them, it's great that they exist. And in terms of just general exercise, I've been really excited to look up resources for folks and find all kinds of different exercise. Everything from Zumba classes that are online to weightlifting to, you know, very basic things to things for more sort of conditioned athletes. And I almost wonder, you know, I have a lot of folks, a lot of my patients who do Rock Steady or other boxing classes. I don't know yet whether there are online offerings from any of those boxing classes, but if you do one of those classes or something else, and you have contacts with any of the other students in the class, see if you can set something like this up. See if you can train together, or set a time every night where you say, all right, I know that at, 7:30 each night, we're all going to go to, into our basement. We're all going to do something. We're going to do the stretches. We're going to do the thing. Having some accountability and knowing that you're keeping up, and that your colleagues and your friends are keeping up as well. I think that's really important. Indu mentioned that we have this crazy idea about karate, which is actually the same patient, this magical patient of mine, who said, if exercise is good and mindfulness is good and Tai Chi and balance is all good, what do you think about karate? And at first I thought it was kind of crazy, but we launched it and people have loved it. And I reached out last week to our head instructor and said, do you know of anywhere that I can tell people to go? Any exercises that they could do online, any videos? And he wrote back and said, Jori, we're in the studio right now, we're filming. And so that's really for people that have already been practicing. So I can't share that link because it's more advanced things. So if you haven't done karate and you just launched into that, I don't want anyone falling at home. But I think, I would reach out if you've been part of any exercise programs and ask them, can they point you in a direction? Is there some way that you can continue your practice at home? I don't know if you had other.
Yeah, that's great. So you mentioned, Jori, something about grandparents and grandchildren.
Yeah.
And I don't know if you want to speak a little bit to that. My parents live pretty far from me. They're in Canada, and luckily they're safe in their homes, and my kids are able to connect with them. But I think a lot of folks are sometimes torn and feel very guilty about, if they were the caregivers of their grandkids, in some households, that they can't see their grandkids, or, there's a lot of generational worries, I think, for even some of us who are in healthcare that are, living near our parents, possibly, and worried about infecting them and stuff. So I don't know if you've had similar issues and what you've been advising people.
Absolutely. So I sort of have both worlds. My parents are in Ohio and far from us, but my in-laws are 10 minutes away. And so we certainly rely on them and love that, they can come and they can be backup childcare, and they really love spending time with my two kids. And we have put in place the grandparent ban, unfortunately, because the safest thing for them, being over 70, even though they're a young 70, being over 70, it's real. And the stats right now don't seem to lie, and the risks do go up with age. And so it's not a matter of keeping the grandkids safe. Thankfully, kids seem to have really been relatively spared by coronavirus. Spared in terms of getting really ill from the disease and being hospitalized and having complications, but they are vectors, meaning just like almost every other germ possible, kids will pick it up. They will sneeze, they will cough, they will touch everything, including grandma and grandpa and papa and Mima and everyone else, right? And it's really, that's why the schools are closed, is so that the kids are not swapping all those germs with each other and bringing them home to parents and bringing them home to grandparents. It's really to keep those who are at highest risk, 65 and over, and with asthma, diabetes, lung conditions, heart conditions, any immune compromised condition. And there's reason to think that folks with PD and with other neurologic conditions really are in that group. It's to keep you all safe. So as much as you want to be there for the grandkids, and I can tell you personally, the grandkids want to be there for you. My 5-year-old has made himself a cape that says C on the back. So he's wearing his coronavirus cape and is convinced that now this means the grandparents can come over because he'll stop the coronavirus at the door and he'll wear his cape and they can't get through. Until that happens, I think the safest thing is being physically distant, but staying socially connected. So can you do FaceTime? Can you chat like this? For my parents in Cleveland, my kids have always had to be by distance, unless we're visiting. So we FaceTime almost every day. And you'd be surprised how young of kids, don't judge me for the screen time, how young kids can interact. So my 2-year-old has been FaceTiming with my mom for a year and a half probably, and loves it, and waves at the screen and gets distracted and, walks away and comes back and shouts. But that is so much better than not interacting. My sister actually, because my mom is a hardcore shopper and she wanted to go grocery shopping for herself, but couldn't, because we've forbidden her from doing so. My sister went grocery shopping and put my mom on FaceTime and walked through the aisles and said, you tell me what you want, right? And so my mom was able to say, no, this flavor, not that flavor. No, this one, not that one. So, I mean, I think it takes getting creative. If you have family members that are in the hospital for any reason and they have a phone with them, FaceTime with them there. If you have family members on dialysis, that's a really lonely thing to begin with. It's a really lonely and scary thing potentially right now. FaceTime with them then. My son calls one of my family members who's on dialysis every time she's there and does some of his reading out loud. It's on his list, it's on her list, and that's just sort of the set appointment right now. And it's not anything we would normally wish for, but I think it's a good thing for everyone involved.
I love that. That's amazing.
I think also, cooking, and I was going to recommend, please, now is the time, order out, support local businesses, Seamless and Grubhub and all the different delivery services that are out there, and restaurants themselves are really trying to stay afloat. And that's a nice way to help, is to order in. But if you're home and you feel like cooking and that brings you joy, if there are recipes that you want to teach someone, right? My mom is an amazing cook. So I'm trying to find a time where she can show me and we can just FaceTime and she can teach me some of her recipes. I mean, as grandparents, if that's something that you love to do that. Now is the time, right? We often think about, oh, we had, so-and-so grandmother or grandfather that had that special recipe and I wish I'd written that down. I wish I'd learned how to do that. This is sort of a gift this time now to be able to think about those things. You can actually do that now because we have the time.
Also, I mean, I think we have patients that are in long-term care facilities, nursing homes, and a lot of those places are, I guess, under lockdown at the moment.
Yeah.
People can't come in and can't leave. So any other thoughts on that?
I think staying in contact with them is super important now. I think the other thing that really only occurred to me the other day was I have a family member who is in an assisted living facility and usually is quite active, goes to all the different activities, except all those activities now, for good reason, are done, right? Because they're trying to keep the residents apart to minimize this from spreading. So can you call and, can you play through some game? Can you read a story together? Can you do something, engage them in conversation, keep them active because they may be really bored and really lonely because the social connection that they have there is now sort of diminished or taken away.
Yeah, absolutely. Yeah, I mean, I think it's a very stressful and scary time because I think they're feeling like they're basically locked in. Even the ones that may have been able to go out for outings with their family or, down the street, I think I have a friend who actually I'm going to have join one of these calls. She's a geriatrician who runs the geriatrics unit of the motion picture hospital that we have here in LA. And she's been trying to figure out similar ways to take care of her patients and keep them motivated and also, stay within the restrictions and the rules that are imposed right now. A lot of people feel, and it's hard because I think we want to show love to our patients and our loved ones and our kids. And I have teenagers and trying to keep everyone safe and socially distanced and show love at the same time without being nagging or like a barking orders at people. There's sort of this fine balance between, sort of trying to keep people safe and getting kind of militant about it. But I do think that it is a time where, unfortunately, this absolute, sort of rules and following them, to the T is and erring on the side of caution and, erring on the side of just absolute shutdown like we're doing in California is really, in my opinion, the right sort of way to go. I know we have a number of folks from all over the country on this call right now, and different people are being given different advice by their local, leaders and whatnot. But I think for our population, I think I was just listening to Dr. Oken's talk as well. And I think as a population of doctors that take care of these patients, I feel like our patients, are, not just from the age perspective, but just as Parkinson's patients have an increased risk of getting sick. And if we get sick, in this population, it's going to be tough to take care of our patients in hospital settings and things like that. So we just want to really emphasize, again, anything that you can do over the phone with your doctor through a telehealth visit like this, really try to minimize going in to, not be exposed to bugs that are around in the environment, trying to stay home in general. And, if you are getting sick from your Parkinson's symptoms, trying to take care of those things on an outpatient basis, not presenting to the emergency room, trying not to get hospitalized is really the way to go. Trying to keep our healthcare providers able to focus on the task at hand, which is really to try to deal with the COVID patients and, trying to follow the rules. If your family is in a long-term care facility, even as a caregiver, it might be very tough for you not to be able to visit your spouse every day, or see them and bring them food and things like that. But it's just really the right thing to do. And it's really a time not to feel guilty and not to feel bad, but just to feel like you're doing the right thing for all of us, you know, trying to battle this right now. So definitely important. Um, so yeah, so somebody here has asked, can we talk about the implications of isolation as it can impact Parkinson's, dopamine, and apathy, etc.? Do you want to speak to that, Jori? I might have a thing or two to say about that as well.
I mean, I think I have a couple things to say. I think, you know, even Parkinson's aside, I think when people are at home, there's this tendency. I mean, I've seen this happen with my own family is, you know, oh, well, we're home. Okay, well, we can, you know, sleep in longer. We don't need to change out of pajamas for a while. Like, it's okay. And for a couple of days, totally fine. But if that becomes the new norm and you kind of slide out of your regular schedule and sort of sleep in longer and go to bed later and shift your schedule and lose some of your usual activity in your regimen, I mean, absolutely, that's sort of giving into the apathy that Parkinson's is already sort of trying to make happen, and fighting off that apathy by sticking to a regular schedule, doing the things that you know you should do, being active in the ways that you can. I think that's really, really important. I think I mean, I almost think of apathy as sort of this like separate Parkinson's monster that just sort of nudges its way in and causes a lot of problems. And we really need to sort of shut the door on the apathy monster, like really doing whatever you can to stay active and engaged, however that looks for you, is going to be hugely important now more than ever. I don't know. Do you have thoughts as far as the implications on dopamine?
Yeah, I mean, I don't think we know exactly about dopamine, but I think that we know as Parkinson's doctors, and you and I, you know, I think agree on these things. We drink the same Kool-Aid on this, Jori. So social connectedness is huge. Social isolation is a real problem that our patients battle. And Lori Mitchell and I have talked about that on this wHolistic offering on with the PMD Alliance before. She has data to show that if you're lonely or socially isolated, that it actually is as bad for you, for your Parkinson's, as if you exercise vigorously 6 days a week is good for you. So it's really, you know, something that we've been, you know, part of our mantra as doctors has been to get people exercising in groups and get out and, you know, get your heart rate up and connect and hold hands and hug and, you know, be in these social situations together. And if you can mix in exercise or being in nature, then, you know, these are things that are all good. Now we're sort of trying to find alternative ways to connect. And I think that still has to happen. And I think, again, from the apathy perspective, we don't have good treatments for apathy, even outside of this issue, and being kind of stuck indoors largely, you know, with our circadian clocks being possibly mixed up, like you were talking about with the sunlight, you know, sleeping in and then staying up at night, which my children are just waking up now and it's 12:30 on, you know, Pacific time. I think many people have been at work for 6 hours at this point on the East Coast. So, so it's very easy to slip into this sort of, it's just sometimes naturally happens. I think strategies that can fight that would be, number one, trying to wake up at the same time every day. You know, if it can be when the sun, you know, is out and like, let's say 7 o'clock, 8 o'clock, something like that, and seeing the sunlight, spending some time in the sunlight, you know, definitely will help your circadian rhythm. Trying to set a set bedtime similarly. So and we'll have actually somebody who is really interested in sleep coming on in the next week, I think, to help us manage some of these as well. So we'll have a sleep specific episode or whatever of this. But I think setting, you know, wake time and a sleep time, I think getting dressed as if you're getting to go somewhere. So showering, doing all the hygiene stuff, you know, early in the day, trying to stick to your schedule, because many of our patients are on medications as well that are timed. So if we get off of our sleep wake cycle, we get off of our getting ready date for the day and eating times, it can really mess up Parkinson's patients and their timing of, you know, for example, Cinemet doses and things like that. So I think, you know, sticking to that schedule as if you were, you know, still on the clock as you had been when you were going to your exercise class and things like that. Maybe scheduling a time for mental stimulation every day. and, you know, whatever that means to you. There's so much online out there right now. You can actually take degree classes at Princeton and Harvard apparently for free. And one of my kids is trying to do some sort of computer science coding thing that's offered from Harvard for free. So really trying to find resources where you can try to, you know, stay mentally active. I think I've seen some resources through Audible with books that are free, that are like on tape, or not really on tape anymore, but whatever it is, audio books. And like, I've just been trying to figure out, you mentioned cooking. I think there's so many resources on things like cooking or crafting, things like that. So finding a time and maybe writing out a schedule of these things for your day, including exercise. And I think, you know, we can still encourage going for a walk outside if it's available to you, or trying to do an online class if it's available to you, or just trying to move in your space, you know, for a scheduled amount of time, multiple times a day. If you can get an hour, that would be great. And Juliet Hirschberg had talked about, you know, some cardio, some stretching, some mind-body stuff, some resistance, all of these things. And if you can think about that and put together something to keep, you know, exercising, that's great. And then, you know, I've been even finding things that historically have brought me joy. So thinking about, like, if I did have the time, as you were mentioning, you know, calling a friend or whatever. My boys are very musical, and they've been playing the guitar and the drums. So I have like an almost band in my house because I have 3 children that play different instruments. But I was like, what if mom learned the bass? What would that be like? And so I picked up a bass yesterday, and my oldest was showing me some stuff, and I'm now trying to play the bass. So I'll keep you updated as we go through this, and maybe we'll share some fun videos of Dr. Subramanian and the bass. But well, you know, so I mean, I think sometimes thinking outside the box of things that you have dreamed about possibly doing that could connect you, you know, in ways, maybe virtually. And I've seen even, you know, people playing different instruments with each other on Zoom, or choir singing together on Zoom with these different boxes. So it's pretty amazing, the technology that we have and how we can connect. I think, you know, Jori, you also mentioned that you had done one of these meetings for, I think, a local, like your synagogue, right? Or something?
Yeah.
Yeah. So maybe
Yeah,
tell us a little
actually.
bit about that.
I mean, so we have a really active synagogue with sort of, you know, people from all walks of life and all age ranges. And they put out a call to say, if anyone wants to teach a Zoom class, share skill, do something, answer questions, whatever. So I just said, well, okay, I can answer questions, I guess. And so I met, you know, sort of like this. It was a much smaller crowd, and talked a little bit about COVID and what does this mean? And this was last Wednesday. So things have even changed since then. But people had really great questions. The grandkid question was very big. Someone actually said, what if you have a cleaning person who's supposed to come to your house? And I said, you know, if possible, send them the check for the week if you're able to do that, but try, you know, keep them in their home, keep you in your home and separate. I think being able to have conversations like that and having spiritual leaders that were online and able to really chime in was so huge. And they've actually put together a whole schedule. They've got story time for kids at a certain point each day. They have, you know, Bible study and different kinds of things going on, and services virtually. So I think if you have a spiritual community, reaching out to them, it may be through Zoom, it may be through, you know, FaceTime, it may be through some kind of other chat, or it may just be calling your spiritual leader and saying, I had a really good day. I just need to share this with you, or I'm struggling and can I share this with you? And, you know, where do I turn to? Or I need some help and I'm not sure how to get groceries. Is there someone who could help me? I think a lot of people are really valiantly sort of rallying and saying, I'm here to help. I don't know how to help. And sometimes people go to, you know, their house of worship with that and say, I'm around if someone needs me, and rely on those centers to be able to connect people. So I think that's a great place to reach out for help, and a place to reach out to give help and sort of say, I'm here and I can do something.
Absolutely. I think that, you know, we all find peace in different ways. You know, some of us are connected religiously. Some of us may not have historically had a religious connection that was that deep, but at times like this, it really brings us towards finding things that bring us peace. And so, you know, if that is something that spoke to you maybe in a time in your life before, it might be something to re-explore, because I think that, you know, we're all just trying to find ways to find connection and peace and solace, I guess. And so I think there are a lot of groups that are meeting like that. And I know, for example, my parents take a lot of comfort in going to temple and, you know, watching priests and, you know, do with prayers and things live and meeting with their social group. And it's been very stressful for them to not be able to do that. And I think some people have even posted the priest maybe doing a prayer in the, you know, temple or something, and being able to connect again virtually has been pretty amazing. There's been a worry of mine, and we've talked about this a little bit on this phone call, of the folks that are not as fortunate as we are to connect even through the internet, may not have a smartphone, may not have a computer, may not have internet, be able to afford internet access. And so one of the things that we talked about doing from this number of, you know, COVID specific, I guess, support groups is to possibly video some of these and put them on a DVD and hand them out to people in the community who could just watch them on, you know, an old school DVD player. Do you have any other thoughts? And I think somebody else had mentioned, so I think in the chat here, words with friends for people who might be also isolated through an app that might connect people, I think is kind of fun to play. But for those people who may not even have access to computers and things from that perspective, what is, you know, do you have any thoughts on how to help some of those patients? And I know, Jori, you can also share maybe a little bit, because we do have some time, about your experience of going into people's homes who are more homebound with Parkinson's even before this.
Sure.
And what you were seeing and how you were, you know, sort of maybe motivating. I know you had a team of people that would go in with you. Such powerful and meaningful research to me, I think, as someone who wonders about how our patients do after they can't come and see us anymore in clinic. Sometimes we have access issues with some of our patients. I know you live in a place with a lot more cold weather and you know, issues with just transport in the winter and things like that. And even some of the long-term care patients that end up going to these places where they aren't able to be transported to see us in offices. I think one of the things that is kind of a silver lining of this whole scene and the sort of telehealth piece is that we may be able to start, you know, if we can really worry less about the billing and the encryption and all the other junk that we've had to worry about before. Maybe this is a new opportunity to reach people in different ways that are maybe less, you know, have historically been less reachable. So I think those are two things. One is, or three things actually. One is, what can we do for the people who may not have this phone, computer stuff? Number two, tell us a little bit about your home visits. And number three, maybe thinking about the silver lining of reaching people like that with maybe this type of stuff.
Totally. So I saw a question that came in from Elaine Book, who's one of my other favorite people, asking the same kind of thing about what do we do to socially connect with people who, you know, maybe don't have smartphones and things like that, and had been thinking a lot about that. You know, I think if you are part of a support group, for example, or, you know, maybe there's some support group leaders here, having, you know, thinking about a phone tree, being able to share that and to say, okay, you know, I'm going to call this person, and when I get off the phone with them, I'm going to ask them to call the next person, you know, and to have that person check back in with me, and to sort of set up a phone tree and have a cascade of people calling other people, especially those who don't have internet access, who don't have a smartphone, who, you know, may be more isolated or don't have as much family. I think thinking about ways just to connect by phone is really important. If, you know, you're going to the grocery store and you know that there's someone in that category who's close to you, you know, and you can pick up an extra roll of toilet paper or, you know, a dozen eggs or something, and drop them on their porch, if that's feasible, I think that's a huge thing to be able to do. I don't know. I've been thinking a lot about this and sort of how do we reach the people that it's hard to know what's going on. I mean, I'll say from home visits, you know, when we're in our ivory towers, as physicians, we think a lot about so many different things, and we can come up with the most beautiful medication regimens, right? So if a patient comes to me and says, well, I'm off at this time, and I've got dyskinesias at this time, and blah, 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 right? We can come up with this very fancy regimen, and we can talk it through, and I can make sure that it's health literacy friendly, and someone can explain it right back to me, and we can teach it back. And I leave, and the patient leaves, and I think, man, we're set. I have fixed their problem. I fixed the dyskinesias. I've got them all steady, right? And they come back 6 weeks later, whenever it is, and everything is exactly the same. What's going on then? Either maybe it was just the wrong regimen, right? Or there were certainly times, especially in fellowship and faculty in New York, where the person was like, yeah, I tried it, but I'm back to the same thing. And it was just this question of like, something else is going on. And so we started this home visit program when I was in New York, and did that for 3 years. We did over 400 visits to people in every borough of the city. It's a catchment area of way too many million people, 13, 14 million people. We saw people in everything from penthouses on Fifth Avenue to studio apartments in Queens that are smaller than this spare bedroom that I'm lucky to have. And realize that, sometimes we make these wonderful plans and say, okay, you're going to take your entacapone at this time and your Cinemed at this time and report back to me and tell me, when you took your food with the this and the this and the this. And you get to someone's home and you realize that they're actively choosing between food and medicine. Or they're actively choosing between taking their medicine and knowing that, they're going to need to rush to the bathroom if they do something, but the bathroom actually is, one flight down. Or is not really accessible to them. And so they're not going to take the medicine, or they're not going to drink their water to keep their blood pressure up, because it's just easier to sort of lay flat than it is to sit up, hydrate, and try to rush to the bathroom. So I think thinking about just the number of things that sort of are there and are in the home that we don't know about. And I think my plea to my patients, my plea to you would be, if there are things that are going on that are keeping you from implementing the strategies that your doctors, that your healthcare team are recommending, tell us. We want to know. I had this patient in New York, and I could not for the life of me understand why his wife kept calling and telling me that he was falling. He was falling all the time. And she would call and tell me, he fell 3 times today. And I'm like, what is happening? He took his meds. Yes, he took his meds. Is he eating? Is he sleeping? Yes, he's doing all the things. What is happening that he's falling? And what they weren't telling me, and what we didn't know until we did a home visit, was that the grandkids had very excitedly adopted a puppy. And then when they got bored and they couldn't really take care of the puppy, they dropped the puppy off with grandpa. And grandpa was so excited to have this companion, but the puppy was totally untrained. And the only trick that the puppy did was to do lazy eights and figure eights in between grandpa's feet every time he tried to stand up. And so this poor man would fall almost every time he stood up, because this very sweet, loving dog, was literally just standing in front of him, and he would freeze and he would fall over the dog. But he was not going to tell us that. And his wife was not going to tell us that, because they were so afraid someone would come and take the dog away. Right? The solution to that is not more Cinemed. The solution to that is finding him a cheap dog trainer. So really, there's nothing that I do that is rocket science at all. If I could tell you the number of times that someone gives me this complicated medicine regimen and they're just not taking it. And I'm like, what is the thing? And it's like, well, spacing it out with all my food and all the everything else is way too complicated. Okay, well, if we're choosing between trying to figure that all out and not really eating and not really taking your meds anyways, or having some diminished effectiveness, but at least getting the food and the meds in, man, do that. It's really simple stuff, which is not to comment on anyone's medication strategies. Talk with your doctor before doing, changing anything. But it's really common sense of what are the barriers, and especially right now, what are the barriers to you being well and taking care of yourself? I would bring back that puppy and say, if you have a pet, man, they think they've won the lottery right now, because you're home, hopefully more than you've ever been before. spend time with that pet, you know, just cuddling the dog, cuddling the cat, staring at the fish, right? Can be really relaxing. So I think, you know, as
Yeah, I
as
think
the healthcare team, we often don't see those sort of hidden barriers going on.
absolutely.
So be mindful, reporting those to us is
Yeah.
really important, especially now.
Yeah, I think that there are barriers to communication often, and there's barriers even to asking for help and being honest about what we can and cannot do. And I think at this time, more than any time, it's important for us to just accept the help as patients, and take care of ourselves and our caregivers, and each and every one of us, and to look out for each other too, because I think that it is, this is the face, this and that, Jori is the face of the modern movement disorder neurologist. I mean, this is not, I think a lot of us are women, are younger, are very different than possibly the old school. I'm not gonna say out loud the exact blue blazer.
We've shed the bow ties. We only wear them now, ironically.
Yeah, but we're very, I think, hoping to be a bit of a new age in communication, and what I think makes a difference for our patients, because we are very open to many things, and I think that's why we're trying to come together at this time to think about strategies that are different than just, take your Cinemet and call me in 6 months or whatever. I don't think that's going to be enough to get us through this, and we need to think about out of the box ways to connect. So people have talked about the friendly phone call tree, which I think is brilliant. Sarah has said that these programs are accessible by phone, which is awesome. And we'll try to, continue to not have things that you physically have to see much. We're not trying to do a lot of slides and complicated things. We'll try to describe things as we come up with. It sounds like the PMD Alliance is recruiting phone friends so that they can try to do this, and any other ideas that you have. I know that the PMD Alliance folks are really interested in just bringing it out to, when we bring things up, they make it happen, it seems like, which is awesome. There's not like 7 layers of needing approval from people. So I think, tangible ways to make cell phone calls to people, and try to get information out, dropping off maybe a DVD to somebody who may not have access, maybe would be good. And the YouTube, I don't know how accessible YouTube is, if people are able to download YouTube and put them for the short term on some sort of mechanism for people to be able to watch this sort of stuff. I don't know enough about technology to say whether that may or may not be possible, but I think that's great. There was a question about whether Parkinson's patients have decreased immunity. Do you want to tell us what you think about that, or?
I mean, I think there's a lot of research going on into sort of immunology and Parkinson's, and immunology, especially the gut, sort of microbiome. And I have a colleague, Natalie Wittick, who's just out of fellowship, and she's got grants looking at sort of immunology and Parkinson's. I think there's something there. I think we just don't sort of have enough details on it yet.
I mean, my sense is that our patients in general, when they get sick, their Parkinson's can get worse. And even sometimes something as simple as a bad cold, certainly with the flu or a urinary tract infection, it can magnify their Parkinson's issues. Another issue is that a lot of our patients can have concerns for swallowing dysfunction and some pulmonary problems, lung problems, breathing problems, just around sometimes swallowing dysfunction. And so I think that, we often have patients that have a bit of a cough, a bit of this, a bit of that. And so anything that you can do to solidly not be exposed to anyone else, so that you're not worried that you're getting germs in your home that could be COVID, and then, trying to figure out the decision algorithm of whether you should get a test and go in and be seen and blah, blah, blah. I think just trying to stay, home right now is the smartest thing. But I would say that, many of our patients, as they age, as sometimes their weight gets reduced as well from, not eating well, there is an increased risk of not being able to fight disease well. And that, I think, is definitely part of the Parkinson's sort of progression in some situations. So I would just err on the side of caution and behave like you are, even if you're in your 40s with Parkinson's or 50s, if you're technically not in the 60 plus age group, just be mindful and cautious. I think we just don't want to be having our patients in anywhere near the hospital or in ERs right now. Try to stay safe. Don't be putting your risk for falling or having other issues that happen. As well, we're trying to get people to generally try to get a month's supply of their medications, at least if you can get 3 months, try to not have to run out too much to pharmacies and things like that. Just try to
And
have
many of the pharmacies will deliver now. So if there's anything that will deliver, groceries that will deliver, pharmacy that will deliver, my advice to my folks has been let them come to you, and unpack whatever from its usual container, take the pill box out of the box that it came in, put that into your, cabinet, and then wash your hands. Same with groceries, take things if you can, sort of put the grocery bag, if it's being delivered, whatever it is, put that, on your front porch, by your front door. If you can, try to get the groceries out of there, put them directly away, and then wash everything, if you're able to.
Yeah.
And I was going to get back to the question about the silver lining, because I think it's a really important question. And I think it was one of those things that this sort of popped up last week. And I almost felt bad for thinking, like, could something good be coming out of this in the midst of how crazy this is? And thinking, well, maybe this is the thing that finally pushes telemedicine to actually be approved. But I don't feel guilty about thinking that anymore, because it's something that our patients have needed for so long. And the technology has been there. It's been a legislative issue. It's been an advocacy issue. It's been a billing issue, and that should not get in the way of patient care. And I think finally it's taken something as big as this to move the government to say, okay, wait a minute. It's important that doctors be able to take care of their patients however they can. And if this is what we need to do, then okay, fine. You can use the technology that's already well vetted and in place. And so I am really hopeful that when we sort of come through to the other side of all of this, all of the, various systems, patching things together, and okay, now it's okay to use this system, and now it's okay to use this system. It'll be a little bit bumpy for now, but I think we'll get through to the other side with having better access to care, so that my patients who otherwise would be lost to follow up, because at some point, if the disease becomes severe enough that you can't get to me, if I can't get to you, and most systems, the doctor can't just take an afternoon to be able to go see one patient, out who knows where, we should be able to connect this way. This is not 1920, it's 2020. We can do this, right? I mean, like, who knows? Elon Musk, I'm sure, is doing something crazy. Like, we can do this. So I do think that's a huge silver lining. And I think one of the other things I was going to mention is, calling each other, and then calling a friend and thinking about that. But one of the pieces that we implemented in our home visit study now, what we'd seen in New York actually was that even though our patients with Parkinson's who were sort of meeting criteria as being homebound outside of COVID, homebound and fairly advanced, even though their disease was progressing over time, we found that quality of life stabilized. And maybe that was just because we were there and they were answering our questions nicely and they wanted to make us happy, right? I don't think that's what it is, but we're testing that. One of the things that we found was that for people who had a care partner, and not all of these patients did, but for people who had a care partner, the care partner strain continued to worsen over time. And I think the important question is, because there wasn't a control group, we don't know what care partner strain would look like in care partners of people who are homebound and advanced otherwise, if no one is reaching out to them, if they're just left to their own devices and on their own. So we implemented a program and we're looking at, how to scale it up. And that's sort of the next steps of caregiver mentoring, which is essentially we trained a whole handful of caregivers who are really experienced, and either their loved one may have passed away or they may still be actively caring. But we said, look, you have the 24/7 knowledge that I will never have, that Indu will never have, hopefully, of caring for someone, living with someone with Parkinson's and being that go-to person every single moment of the day, right? And so as much as I could come up with, here's the regimen for constipation, right? It means more coming from someone who's lived through this and, you know, had their loved one try the rancho recipe and the paste and all the other things and gone, all right, screw those things. Here's the thing that really works, right? It's going to mean more coming from that person who's done it. So we are looking at that and sort of having a curriculum, but what it really is having a caregiver call another caregiver every week and check in. So as much, you know, if you're thinking about your friends and your family, if you have the bandwidth, if you know someone else, you know, living with Parkinson's, if you're a care partner and you've been to a support group and you know some of the other care partners, check in with them. Even if it's for a 2-minute, hey, this sucks. Or, you know, hey, today was actually a good day. Here's what we did. Or, you know, we watched the video online from the Shed Aquarium, shout out to Chicago. The Shed Aquarium took their penguins for a field trip and they let the penguins walk around the aquarium and visit the other animals, right? Watch that. Tell someone else about that. If you're familiar, you know, with like the Mo Willems books for kids, Mo Willems has opened his studio and he's filming himself doodling and teaching kids to doodle. That's not just for kids. My father-in-law is doing it. He's 71. You know, share some of these resources with someone else. I think that's an incredible way to pass it along. And it doesn't have to be FaceTime or Zoom. That can just be a plain old regular phone call just to check in.
Absolutely. Well, that was very powerful. I think that what you said about the home visits and the caregiver strain is important. And I think we might have one or more of these just around caregiver stuff, which I think is underrepresented and unspoken about sometimes and lost in translation. So continue to please, you know, audience, you know, share this with other folks, other patients, other caregivers, anyone who runs support groups, you know, get this out there. It'll be on YouTube. I think there's one question about donating blood right now. I know a lot of people are just trying to figure out, they feel helpless at home and Jori, you and I were speaking about, you know, trying to help support the frontline folks, you know, as well as we can. The question was whether Parkinson's patients should be going out and donating blood right now.
I don't know of any data. I mean, I'm very torn, but my gut would be, I would just worry about people going out and I would rather they stay home.
Yeah. Yeah. I think that would be what I would say too. The risk, I think there's, again, everything that we talk about has a bit of a risk benefit analysis. So if there is a risk, that could be that you would be, and one of the problems that we've talked about so much is that there's so many asymptomatic carriers. So I think that's, you know, the blood draw person could be carrying, it's just hard to know who's infected right now and not, people aren't getting tested. And that may change in the future, and this video may be dated, and I'm hoping that we can, you know, all go back to some semblance of normalcy relatively soon. But, you know, as we're getting information right now, I would say, well, let's just wait on that and have our patients just be safe at home. And I know that people do want to give back, and I think the ways that we're talking about giving back are around connecting with those that are less connected even than you. I think that's very safe. So calling the calling tree, connecting with your family, you know, staying in touch with each other, these sorts of things, staying safe, you know, you doing the right thing by trying to stay out of the hospital and minimizing, you know, stressors there is important. And following your doctor's advice around that safety stuff is really important. There's been some talks about, you know, people making masks and other things. I think that remains to be seen, you know, how helpful those strategies will be. And I know there's a lot of people in the population at large trying to gather energy and resources. So stay tuned. But I think, you know, you doing your piece about, you know, just trying to stay safe and connecting possibly with others through phone calls and this mechanism is what I would encourage people to do right now. I think we're almost at the end of the time. Did you want to have one last last piece of advice, Jori?
Yeah, I mean, I think kudos to you all for being engaged and being part of this and being part of the broader PD community. I mean, this community is so incredibly strong and inspiring every day before any of this hit. And I think the fact that people are coming together and supporting each other like this is just even more testament to how much you are all fighting this off in so many ways. So please, you give us inspiration So I just want to thank you all for being part of this.
Okay, over to you, Andrea. Thanks. And we'll have, I think Friday, we have a psychologist who's amazing that I actually met on Facebook who's going to be joining us. And again, looking for silver linings, I think is really, trying to stay positive. Silver linings is kind of my little hope right now, and staying safe. Andrea.
Oh, thank you both for joining us. And I echo you. Thank you to everyone who tuned in, some of you for the first time. Bravo for mastering technology. I have one request before we go. Who's high-fived 54 people recently? No one. What if we try a virtual high five? Some of you turned off your video, maybe have your jams on, but if your video is off, because you turn it on, and we're gonna all we could do a high five, we could do hugs, just wave, but just wanted some group eye contact as we part and say bye to everyone. So thank you again for joining. Like Dr. Subramanian said, we're gonna, oh, I see a doggy. We're gonna have the recording up and some of those resources. Everything is on our, on the social distancing special series webpage, and we hope that you all come back this Friday at noon for more. Thank you again. Bye, everyone.
Bye.
Thank you.